Okay guys, I'm here in Zaria to support this great event happening tomorrow about helping pregnant women to improving childbirth in Zaria in Nigeria. Tomorrow what we expect to see will be things like medical checkups, the state of the babies, not scans though, but little things like health checks to be able to make sure that, and also giving advice to women that are pregnant. So there are quite a few experts in the field that are coming tomorrow, and I think when you do research about maternal death rate in some of the poorest countries in the world, goes without saying that we do need to make a change, a significant change in this area. So just follow us as we capture this tomorrow, and as we talk to these key stakeholders who have great interest and passion to basically see a change in this area.
Not generally what's going on, we're just trying to contribute to the society in our own little way. If you call it corporate social responsibility. Kaduna, sometime last year, I was going to different local governments and villages while I was local, and because I have a passion for maternal health, so I did assessments in various villages and wards, and just asking questions, making interviews, and just see how the system works here. And yeah, I got interested in this particular community. They were welcoming. I think it was the most positive one I got. They were welcoming, and maybe because of the language barrier, I was more comfortable because I had to do the talking myself. Because the people I was with, they had to do the interpretation for me, which didn't, I didn't really flow about it. So, but with this one, I did it myself. Everything was just nice and fast. Okay, needed to do something here. Oh, I needed to do something, but I decided to pick this word. And so we're looking at having put together, I and my partners, the seminar health talk with the pregnant women. The event generally is supposed to be like to improve how to improve the maternal care, just general health check. The basic ANC package was to give them the clean mama kits to every pregnant woman that turns up, just to encourage them, basically, because we're just thinking like all these things are the necessary things. Because when I did my assessment, when I asked questions, they were like those little things about what causes maternal mortality. And I'm like, okay, since I just want to do something, I might as well just give it to them.
My name is Olise Leo Osameka. I'm the National Coordinator of Social Welfare Network Initiative. Principal partner with Prime Diamond Initiative for Community Health, the lead organization for this reproductive health seminar holding tomorrow in Zaria, Kaduna State. Right now we're in Kaduna. We're heading to Zaria, the ground zero for the seminar, holding tomorrow morning all through afternoon, then which will also culminate into distribution of mama kits, baby delivery kits for pregnant women and for kids. Basically, the intervention is a Prime Diamond Initiative for Community Health intervention. It is an outreach put together by this wonderful NGO, founded by my lovely sister, the ever beautiful Nasa Onukekbe. And it's been a roller coaster ride from the assessments conducted last year in Zaria, and if you're in quite a number of communities we have visited to look at the health index, the delivery systems, the facilities, the personnel, professionals, and all that. All of that was part of the assessment that was carried out last year, and of course the planning stages which began early this year. Then the last 2 weeks we've been on this. She's traveled in and out of Kaduna. I mean, she's a very strong woman, I must tell you, and it must be passion pushing this.
For more collaboration with both local partners, international partners, state, federal government, everybody's involved.
Okay.
And there was one caption that came to my head last night. It's that to challenge not like big parastatals or big companies, but every individual. You can sponsor your ward.
That's true.
Yeah, sponsor either you sponsor your ward, sponsor your village, sponsor an individual, just every
Pick two
little
people,
helps.
one person, three
Yes,
people.
and just make an impact one way or the other.
So this is more like motivating people.
Like a challenge,
Yeah.
like challenging everybody.
Yeah.
So not necessarily like a big federal government or state government.
Every life matters.
Every life matters. So even if it's your neighbor, you can just pick out and just sponsor. As in, the women are all important in your life. What do you say again? Educate a woman.
You have trained the community.
Educate the community. So at least if you can impact on each, we talk about empowerment as well. So you have to like challenge their conscience. Even if you don't have any pregnant woman amongst you, at least you have a sister, you have a mother, you have some feminine gender around you. So I think to take it upon themselves to make an impact.
Okay, my name is Shade Samuel. I'm a consultant midwife practitioner. Been doing this for close to 18 and a half years now. And I run New Beginnings Birth Center and Life First Foundation. Come together with Pdich to see if we can make a difference. We see this every day as practitioners. Coming into Nigeria 8.5 years now, going into some of the centers and having to view the kind of poor healthcare systems that we have. And I think you achieve this because of education. Education is power. The more you can inform a woman about her choices of a healthcare system, what's available to her, what she can't do, what she shouldn't be doing, what she should be doing, to be able to even help in her own processes to having a safe delivery. I think it's really important that we empower our healthcare assistants, our TBAs, husbands. It's a holistic care package. It's multidisciplinary, and I think we're not tackling it here at all.
So tomorrow, the women, at least 200 women minimum, will be able to be cancelled. They will be educated on the basics of ensuring that they maintain strong iodine content for themselves and for their babies. Also maintain strong nutritional status for themselves and for their babies. They will also be taught on basic antenatal issues and why they must also use the facilities, the hospital facilities, because in this part of the country, Kaduna State is in northwest Nigeria. This part of the country, the practice of the traditional birth attendants is really paramount here, because of culture, religion, and what have you. All of these contribute to such practices. So the idea basically is that intervention, aims to bridge the gap between there's services being provided by traditional birth attendant and the services supposedly meant to be handled by the health professionals.
But thank God with this NGO that came now, it can help them, since that's what they are fearing. Money for those items, delivery items. That's only what makes them fear to come to the hospital. In our clinic, we doesn't even collect delivery fee. Those delivery fee, they only come with that items that are going to be given to them at home. That's only what is needed from them. And still, some men cannot afford to go to those items they need for delivery.
So this item will not be given to everybody pregnant tomorrow?
So tomorrow,
Yeah.
not all of them will be.
So who are we targeting these items for?
It's for those women from 8 months to 9 months.
8 months.
It's the one that has been targeted. Yes.
Okay, so they will be able to find these items useful.
Yes.
Okay, and okay.
And I learned that even misoprostol is going to be added to that kit, and which is very helpful for them, because some women when they deliver, they used to have this problem of bleeding. Yes, and that misoprostol really helps in stopping that bleeding after delivery.
But this pack, are they meant to bring it with them to the clinic when they're about to deliver, or is it for them to take home and use it at home?
No, they will come with it when they're about to deliver. They will come with it to the hospital. Yes, when they're about to deliver.
And is there a booking? Is there only one health center for these women to come to, or do they have different health
Well,
centers?
here in this Tukutuku district, we have 2 clinics. We have one in Tukutuku and the other one in Pdich. This is 2 clinics.
So these are the clinics that these women can go to when they're about to deliver their babies, to go to one of these 2 clinics.
Yes.
Is these 2 clinics, are they enough?
Really, they are not enough. Because there is still an outreach area, so where women cannot even come to the clinic. It's not enough.
So the women coming tomorrow, what percentage, how many of them are between 8 to 9 months pregnant, you know?
Out of those that just come to the hospital for advance,
Out of those coming tomorrow, how many are between 8 to 9 months pregnant?
how many of them?
Is there,
Almost 70%.
are already,
They are about 8 to 9 months pregnant.
so
70%.
So, what sort of issues normally come out from women having children at home? What difficulties do you now find out about after
They have this bleeding, case of bleeding, which will take women to death. They have a problem of getting sepsis. Because the place where the woman is going to go to be delivered at home is not well clean. From there, the woman and the child can take infection. Will have this neonatal sepsis. Thank God, ma, for this NGO, inside the kit that want to be given to them, they put one gel that is protecting the children from getting that sepsis. It is going to be used on their court.
Okay, what more would you like to see this NGO do? Apart from what they're doing tomorrow, what else would you like to see them do more so to help this situation?
We want them to do more, really, because our women here, they are in need of this supportive organization. They really need them. That's why you see I'm asking her, it's in this program they are going to do for tomorrow. Is it going to be sustainable? Because we know there are many women that need that kit for delivery in my clinic.
I would describe our health center, especially the primary healthcare center, as underdeveloped. They are not standard enough. They are not standard enough in the sense that some of those places don't have basic amenities. You can't come in the night to deliver. 2, they have unskilled personnel. Because the skilled personnel who are being sent there to work are not being paid by them. Like I stayed in Gombe State for almost a year, being posted to Zambu maternity. We were willing to work. I chose Gombe State. That's even when there was crisis in the northeast. I wanted to go there. I went there, but we're not motivated by the local government. We cannot keep practitioners without remuneration, because remuneration is motivation.
That's right.
And then when you don't pay them, you want to work, you don't have instruments to work with, you don't have things to fall back to, and the risk of infection is getting high. And with infection, anything can happen. And then the women, once they come to the clinic is usually locked in the night, because we use torchlights or candle to deliver women. And it wasn't safe for us, because even we don't have security there, our lives have been threatened. In as much as we wanted to deliver quality health care, but the means to deliver this quality health care, those things we need to aid quality health care weren't at our reach, and our lives were being threatened. So we have to close up early. When they come the first time and the clinic is closed by 7,
Or even earlier.
yes, or even earlier, they'll go back home to their TBA. And you know, TBAs are not being seen as,
They don't recognize.
I don't really recognize, because of one, they have poor, it's not as if they don't do deliveries, they do deliveries, but they have they have poor aseptic techniques, and people need to educate these people. And for you to educate them, things needs to be put on ground for you to educate them, for you to motivate them, so that they'll be able to cooperate with the health workers in terms of when there's any deviation from normal, they can be able to refer to the appropriate authority. Another thing is this: we have very few hands in primary health care settings.
Yes, there's not enough.
So what we intend to do tomorrow is to first of all ensure that every woman who comes into this intervention gets basic health check. So there's going to be blood pressure check. They're going to weigh them. They're going to weigh them to ascertain what they actually look like. You know, I mean, when a pregnant woman must look good to be able to put to bed a strong, healthy child. Then, of course, we're going to do sugar level tests. There's a whole lot of stuff that we've planned out for tomorrow. Already deliver the delivery kits. It's going to be more of interactions. The consultant who is main discussant for tomorrow is on the way. He's coming from Abuja. So far it's been good. It's been good.
Well, ideally, a lot of the times trying to deliver a baby at home is what these women know already. We're trying to get them by doing these outreach programs to come closer, and that the hospitals and the healthcare systems are getting better and they will help you. Delivering babies at home, even if you were and you could afford your whole package and have your baby at home, there's no way that we can guarantee that there will not be any complications. But what we know that is the birth attendant taking the delivery, be it your midwife, a doctor, knows when to refer you. Now, a lot of these women will have their babies at home and have had their babies at home. Some of them have been delivered by Auntie Carol. They delivered her, she delivered their sister, she's delivered everybody else. And so it was a normal delivery. It had less complications. It has its risks if you're not trained to be able to determine a deviation from the norm. So the best thing is that you can detect the deviation from the norm. A woman that delivers a baby that starts to bleed, and uncontrollable bleeding. There's a thing when you're trained to understand what kind of different consistency blood should be, you know when this blood that's hitting the floor has lost all its clotting factors. You know you need to refer. You know a lady, for instance, you're delivering a baby and you feel or feel a foot. That's a complication. I think if we empower our TBAs and we make sure we give our nurses and midwives that go home or do community outreaches an incentive to make sure that they are monitoring what goes on outside, home birth would be safe. We do it abroad. People have been doing it here for centuries.
This issue of MGD 4 or 5, which has been reviewed now, that whatever you want, we want something that will be sustainable. In line with that, His Excellency, the Executive Governor of the University, has made some positive efforts with the international community. And then ensure that he will renovate one facility per ward, making 255 less facilities that they are going to work for 7 days, 24 hours, so that issues of maternal health will be dealt within the primary health care level. You know, most of the things which you have looked into, there's still minor challenges which if our facilities are put properly in place, with not necessarily having a doctor, but even to have the midwives that will come and assist. But you see that at the end of the day, we have quite a number of PACs which were used based on political reasons that you cannot even maintain them. We don't have the staffs that will manage such facilities. Even though we're working at the primary health care level, then we need to go a little bit advanced. That at the primary health care level, you will see that you have a nurse, a midwife, and then a community extension. So with that, where you have been based now, is a settlement where it's rich. That rich in the sense that we have technocrats, we have people who are educated at that very settlement. But to some extent, if you go down, you see poverty there to some extent in some areas. So with that, basically to us as a local government, we're happy, we appreciate, because you have keyed into the agenda of His Excellency. We are here to provide some innovations and then interventions as well, so that at the end of the day, where we have the challenge, if you see our records, you see that a woman may come to the facility only once, and then she will not come back. She will deliver at home. Why? So it's part of ignorance, and then part of, is it the facility doing the right thing at the right time? We have community health extension workers, which their job, particularly the STU, is 40% outside the community. And then for the junior community, they have 60% outside the community. Then you see that at the end of the day, you see everybody sitting at the facility waiting for the patient to come and see him. So these are the things which I'm happy you help us to change the attitude of our staff. We're doing our best by rewarding and then punishing those ones that are born here. But still, as a NGO, we are happy to have much and much of you in Zaria.